Greetings from Cleveland, Ohio. My name is Anand Kumar from Case Western University School of Medicine and Rainbow Babies Hospital and University Hospitals Cleveland Medical Center. I have the opportunity to present a wonderful article in the upcoming October issue of Plastic and Reconstructive Surgery entitled Thresholds for Safety of Cleft Lip Surgery in Premature Infants. This is a nice study that looks at the NSQIP, a large database looking at surgical outcomes in children. And this study looked at were there any factors associated with surgery in young children, and at what particular time might it be optimal to perform surgery and minimize complications. So this group looked at one-sided clefts or unilateral and two-sided clefts or bilateral and found some very interesting findings. Well, the first and the good news for patients and families is that the overall incidence of complications is very low, roughly less than 2%. But children who are under 6 months of age for bilateral clefts or children under 5 months of age with unilateral clefts had a higher incidence of perioperative or 30-day complications. And so, in particular, children with prematurity or children with cardiac or heart disease. So I think this is a great paper in that it allows us to have a nice conversation with families. Obviously, anyone who's taking care of a family who has a child with a facial difference or congenital abnormality, everyone is quite anxious to try and get the baby repaired and restored to wholeness as quickly as possible. And I think this paper allows us to have a nice conversation to balance the needs of the family to make their child whole, as well as maintaining safety, and provides us useful information from a large database, which at times can sometimes be challenging to find meaning. So I applaud the authors for finding a nice conclusion and some usable guidelines for us as we consider and take care of children with facial differences with cleft lip and cleft palate.